Thank you so much. It is great to be here, everyone. Thank you so much for attending my talk. And today I am going to be talking about body image, a topic that usually isn't brought up very much, even though it has the potential to make a big difference in our overall well-being. In particular, I will be talking about how body image has the potential to make an impact in our sensation and pain management. So let's start out by clearly defining pain. When we think of pain, the first thing that pops to mind is usually the physical experience of pain, the sensation of discomfort. And in reality, pain is shaped by more than just the physical. It involves our emotions, our thoughts, and it can really impact our social functioning. Pain is also shaped by whatever other comorbidities we may have going on. And the relationship between them is typically bidirectional, meaning that they both impact each other. We can see this relationship more clearly if we look at it through the biopsychosocial model, which is essentially a framework that maps out all health determinants, not just the biological piece. Optimal health management involves optimizing not only a person's physical functioning, but their social and psychological functioning as well. The construct of body image has the potential to affect all three of these areas. So let's begin by defining what body image is. In a very broad sense, body image is the experience of embodiment, of living and occupying a body. If we narrow it down a little bit more, we can define body image as a person's mental representation of their body, a concept known as perceptual body image, and a person's attitude towards their body, which we call attitudinal body image. Perceptual body image can be prone to distortions. Ideally, we would want the mental representation we have of ourselves to be accurate, but that's not always the case. For example, a hallmark of anorexia nervosa is distorted size perception of the body. And also, there are many ways that a person can feel about their body, some of them positive, some of them negative. And then some people don't feel much of anything towards their body at all. This is a concept that we call neutral body image. Having an accurate and positive, or at the very least, neutral body image can be very beneficial for health management. And having an inaccurate and negative body image can be detrimental to our health. Therefore, any intervention that positively targets body image can serve as a catalyst for healthy change across multiple domains. To demonstrate this, I will be talking about the impact that body image can have on three conditions that often go hand in hand: pain, depression, and obesity, which I've called the Pain Triad. These conditions all have a bidirectional relationship with each other, such that a change in one will likely trigger change in the other conditions. And in the center, we see body image, which has the potential to affect pain, depression, and obesity independently. A distorted and negative body image will impact these areas adversely, while an accurate and positive body image has the potential to bring about positive change in these areas. And since these areas are all interconnected, healthy change in one area can carry over to the next one. So let's see how that will look like. To start, I will first discuss some of the impacts these conditions have on each other. I will say that the examples I'm going to provide are not comprehensive. There's many other examples that I could give, but for the purpose of this talk, it provides enough information. So let's go ahead and begin by discussing the relationship between obesity and pain. Obesity can make pain worse due to the biomechanical changes that it can produce in the body. So obesity can disrupt the functioning of certain hormones in the body, which can then lead to central sensitization. where the central nervous system becomes more responsive to pain stimuli and the effectiveness of pain inhibition pathways are reduced. This same hormonal disruption can lead to the development and maintenance of inflammatory pain by sensitizing pain receptors in the peripheral nervous system, and it can also lead to disruptions in neurotransmitter functioning. Now, from a mechanical perspective, extra weight on the joints can cause extra stress in completing daily activities, which accelerates the wear and tear of joint cartilage, heightening the risk of developing osteoarthritis. Excess weight also changes the body's center of gravity, which requires the muscles to exert more effort in maintaining balance and mobility. This can result in muscle fatigue, pain, and a heightened risk of falls and injuries. Now, pain can also contribute to the development of obesity through various means. Pain can limit an individual's ability to exercise or to engage in physical activity, which of course can lead to a sedentary lifestyle. Pain can also influence eating behaviors, often increasing cravings for high-calorie, fatty, or very sugary foods. We call this hedonic hunger, which is eating for comfort or pleasure instead of for sustenance. Disruptive sleep is also a reality for many people living with pain, and it can lead to hormonal disruptions that heighten hunger and appetite and decrease the sensation of satiety. Disruptive sleep can also lead to a slowed metabolism. And also, the experience of living with pain can cause a lot of stress. Stress triggers the hypothalamic pituitary adrenal axis, leading to increased cortisol secretion, which can lead people prone to weight gain and a risk of insulin resistance. Now, let's talk about how depression and obesity influence each other. Obesity can also induce neuroinflammation, which can disrupt the functioning of neurotransmitters involved in mood regulation. Neuroinflammation also reduces levels of brain-derived neurotrophic factor, which can worsen neural changes associated with depression. Obesity-induced inflammation can play a role in disrupting the gut-brain axis. The gut has millions, trillions actually, of microorganisms living in the digestive tract. A disruption of these microbial communities can lead to reduced levels of beneficial bacteria and an increased presence of pathogenic or bad bacteria. A lot of neurotransmitters involved in mood regulation, such as serotonin, are produced in the gut. A disruption in gut functioning can affect the production and release of these neurotransmitters, and they can also alter vagus nerve function, which can affect brain function and lead to mood disturbances. Depression can significantly contribute to the development of obesity. Unfortunately, society has imposed a lot of negative stereotypes to individuals with obesity, and additionally, evidence of bias against overweight individuals is well documented and can lead to discrimination that leads to the avoidance of doctors, gyms, and other settings where people believe that they are going to be judged. This stigma can also impact eating behaviors. For some individuals, it can actually lead to binge eating, which is a big predictor of future weight gain. And finally, let's talk about depression and pain. Chronic pain can cause changes in the brain's structure and function, particularly within the prefrontal cortex and the amygdala, areas that are important for decision-making and emotional processing. Chronic pain is associated with reduced gray matter in the prefrontal cortex and increased neural activity and neuroinflammatory processes within the amygdala. These brain changes leave people vulnerable to developing depression. Because think about it, they're not doing their best thinking and their emotions are all over the place. The psychological toll of living with chronic pain is extensive. So people that saw themselves as providers, if they're living with severe enough pain, they may not be able to work anymore. That can leave people without a role and possibly with financial strain. Repeated unsuccessful attempts at pain management can leave people feeling without control. It can put their locus of control externally. That is actually a powerful predictor of depression, and it can lead to learned helplessness. Depression can make pain sensitivity worse by lowering pain thresholds through changes in those same key brain areas, the prefrontal cortex and the amygdala. Depression disrupts the functioning of neurotransmitters like serotonin and norepinephrine, which help modulate the descending pain inhibitory system. Depression also affects pain-related thinking, making people pay more attention to their pain and think about it more negatively, which makes pain perception worse. A hallmark symptom of depression is reduced motivation and energy, which can interfere with proactive pain management strategies. So now that we've clearly defined the way in which all the elements of the pain triad affect each other, let's talk about the role of body image and how it has the potential to enact meaningful change in each of these areas and across the whole triad. So let's start by talking about body image and obesity. Now, before I start, I do want to say a couple of things. First of all, having excess weight does not automatically mean that a person has an inaccurate or a negative body image. It's perfectly capable of having an accurate and a positive body image to themselves. And it also doesn't mean that a person is obligated to lose weight. Losing weight is a very personal decision. But for individuals who are looking to lose weight, inaccurate and negative body images can make the process harder. So first of all, accurate size estimation is crucial for weight management because we want for individuals who could benefit from weight loss to be able to recognize it. And we also want for individuals who would be harmed by weight loss to not engage in it, to avoid it. Now, in terms of attitude towards their body, having a negative body image can make people more vulnerable to developing shame by really buying into a lot of negative societal stereotypes and stigma. And that can really lead to an avoidance of doctors and gyms, decreased social engagement, and so on. These behaviors, all of them together, can lead to an increase in sedentary behavior. And it can lead somebody to feel so ashamed of their body and so ashamed of their eating patterns that people can turn to very restrictive, unhealthy, and ultimately unsustainable dieting practices that then could trigger an episode of binging because after a while, the hunger sensation would be so strong. And then after a person binges, they tend to feel very ashamed of themselves. And over time, they could return to these restrictive dieting practices, essentially putting in motion a very destructive cycle of restriction, binging, shame that can perpetuate for a very long time. So all of these conditions, shame, avoidance, restriction, create conditions that really are not optimal for healthy weight loss. Now, on the other hand, accurate and positive body image can enable a person to make more informed decisions about weight management and to increase their sense of self-acceptance and resilience, which can be very strong protective factors against shame and all of the bad stuff that can come along with shame. Without shame, we create conditions that are more conductive to being engaged with the world, to being active, and to not really feel the need in engaging in very restrictive dieting practices that can lead to some pretty bad side effects. All of these conditions, at the very least, create better conditions for people to lose weight and keep weight off successfully. So how does all of this help pain? Well, less stress on the joints can decrease the risk of developing osteoarthritis. It can also improve mobility and physical functioning. It can also decrease the inflammatory response and decrease the chances of developing central and peripheral sensitization. And it can also promote better enhanced sleep. All of these conditions are very important for proactive pain management. Okay, now let's move on to depression. Depression can trigger some pretty bad outcomes that can be made worse by having a poor body image. Depression can actually make neurological changes in the brain's insular cortex and parietal lobule, which are important areas for self-perception and bodily awareness. This can lead to distorted perceptions of body size, shape, and a person's overall appearance. Now, these changes can happen even to individuals that previously had healthy body perception. So imagine what it can do to somebody who already has a poor perceptual accuracy of their own body to begin with. Again, very typical of depression is a lack of motivation, which can then impact personal grooming habits, leading to an unkempt appearance that can really leave people feeling bad about the way they look. It can even impact the efficacy of certain medications by causing changes in metabolism and impacting pharmacokinetics. And finally, certain antidepressants can cause weight gain as a side effect. So this can be stressful for anybody, but for someone who struggles with their body image, it can be a lot. It can be too much to handle, and they'd rather discontinue taking the antidepressants, which can be very helpful for them, rather than gain weight, which can lead to poor treatment adherence. In this particular case, poor body image can serve both as a trigger for depression, or if depression is already there, it can serve to perpetuate it. Now let's look at the opposite scenario. Somebody that has an accurate size perception and positive emotions surrounding their body are protected against some of these more harmful neurological changes. They're much more likely to have a healthy sense of self-esteem and acceptance. And their functioning overall, day-to-day functioning, is more likely to be normal functioning, which creates conditions for increased medication adherence and for making healthy lifestyle choices. So people that are sleeping well, eating healthily, are socially engaged, are engaged in physical activity, engaged in hobbies, all of these things will have a lot of both physiological and mental benefits that can be great for treating depression or for protecting against the development of depression to begin with. So how does this help pain? So alleviating depression can increase pain tolerance and help us not dedicate as much time to thinking about our pain. It can also give us a better chance of our medication working as intended, and we may even lead less of it if we don't need to take antidepressants anymore. We have more motivation and energy, which can be very useful for proactive management of our pain. Now, how does body image impact pain directly? Well, first of all, there are several pain management techniques that rely very heavily on body image manipulations directly. Those are mirror therapy and virtual reality therapy. Let me talk a little bit more about those. Mirror therapy is a rehabilitation technique that's used to help improve motor function and alleviate pain in limbs, most commonly after a stroke, an injury, or in some cases, phantom limb pain following an amputation. The basic premise is using a mirror, we can create a reflective illusion of an affected limb, making it appear as if the affected limb is moving normally. You can see that in the image to the left. This can really help think about it of rewiring the brain and potentially improving the perception and control of the affected limb. Now, for virtual reality therapy, creating avatars is a powerful tool that uses the concept of embodiment and the immersive capabilities of this technology. Embodiment in virtual reality therapy involves the sensation of having a virtual body that replaces or supplements the physical body. And for some pain conditions, especially those requiring physical rehabilitation, embodying an avatar that moves freely can encourage users to perform exercises and movements that contribute to their physical therapy, potentially in a way that is less painful and offers a degree of distraction. Engaging in tasks as an avatar can lead to changes in how the brain actually processes pain. By repeatedly performing activities in a pain-free virtual context, people might experience changes in their neural pathways that contribute to pain reduction. Now, although these manipulations have brought pain relief to many people, they may not be appropriate for everyone. In fact, in some cases, these techniques have actually made pain worse. And there are several factors that can determine whether someone will benefit from these interventions or not. Now, in terms of the interventions themselves, the accuracy of mirror reflections and the degree of immersion of the therapies are very, very important. People going in with the right set of expectations and the correct level of engagement is also crucial. And the presence of certain psychological comorbidities like a heightened sense of depression and anxiety will also reduce the efficacy of these interventions. However, there is another factor that is also of critical importance in determining whether someone will benefit or be hurt by these sorts of manipulations. And that is a person's level of baseline attitudinal body image. Baseline attitudinal body image significantly influences the outcomes in both mirror therapy and in virtual reality therapy, since these approaches rely very heavily on visual and perceptual engagement with one's own body or an avatar representing the body. Individuals with a positive baseline body image may be more likely to engage positively with mirror therapy because seeing the reflection of a healthy, moving limb can reinforce positive perceptions and attitudes towards their body's capabilities, which could enhance the therapy's effectiveness by improving motivation and adherence. Also, for those with a positive body image, virtual reality therapy that involves embodying an avatar can be seen as very empowering and motivating. Engaging positively with an avatar of themselves can enhance the therapeutic experience and make it easy for patients to perform exercises, adhere to treatments, and possibly achieve better outcomes. However, individuals with a negative baseline body image may experience challenges with both types of therapy. If a person's already dissatisfied or distressed by their physical appearance or their capabilities, the mirror reflection might exacerbate these feelings, possibly hindering engagement with the therapy or diminishing its effectiveness. Individuals with a negative body image might also struggle a lot with VR therapy, especially if it involves creating and interacting with an avatar. So if that avatar does not align with their perceived appearance or bodily ideal, or it highlights aspects of their appearance or capabilities that they are not comfortable with, it could lead to decreased engagement, reduce the efficacy of the treatment, and possibly make existing body image concerns worse. Which is why it's important, first of all, to assess a person's baseline level of body image to determine where they're at. And if a person doesn't particularly have a positive sense of body image, then perhaps incorporating certain techniques or strategies to raise that attitudinal body image might be indicated. Or perhaps these are not the sort of manipulations or techniques that would be appropriate for that individual. So now that I've spoken about the importance of body image across several domains, let's go ahead and pivot. I want to discuss ways that we can work on achieving a healthy body image. And by the way, even though I've spoken about body image in the context of health management, anybody, even people who are not currently struggling with a health condition, can benefit from these techniques I am about to present. Healthy body image is useful for anybody. So let's start with one of the simplest strategies, and that is curating your media consumption. So it's no surprise to everyone that the sort of media we're exposed to on a daily basis tends to promote body standards that are very difficult, if not impossible, to achieve. And when we compare ourselves to those body ideals, which for women include youthfulness, thinness, for men being tall, being muscular, we usually tend to engage in downward comparison. And that can really leave us feeling very bad or maybe lazy and unmotivated. So trying your best to try and not consume that type of content as much and instead seeking body positive content can go a long way. Clothing choices. So when I used to work in weight management, this was one of the most commonly prescribed interventions I gave people. A lot of people told me that they didn't feel like they could dress the way they wanted to until they lost some weight. But as a result, they were dressing in clothes that didn't leave them feeling good about themselves. They felt bad. That didn't really boost their confidence. And as a result, their weight management efforts were not going fantastic. So I always told people, dress to feel good no matter what size your body is. And dress for yourself. Don't dress for any sort of external validation. I also encouraged people to challenge themselves and wear an item that perhaps they felt like they couldn't wear. I had somebody who didn't want to wear tops without sleeves until they lost more weight. And I challenged that person to just wear, a sleeveless top, go out there, see what happens. She was pretty nervous, but she did do it. And then the next time she came back saying, you know what, nobody really looked at me. No one cared. And that experience was very empowering for this person. So make clothing choices that will leave you feeling good about yourself, regardless of size. Engage in positive affirmations, particularly about your body. I had some people tell me that they felt like this was all hippie stuff, honestly. But in reality, positive affirmations have their basis in cognitive behavioral therapy. A central premise of cognitive behavioral therapy is that the thoughts that you feed yourself are going to have a very significant impact on your emotions and your behavior. So if you feed yourself thoughts that empower you, that promote self-acceptance, it's overall healthy for your behavior and your emotional regulation, as opposed to if you constantly engage in thoughts that insult yourself. So say good things about your body, things that promote acceptance, and you will reap benefits. Challenge yourself to give non-appearance-based compliments. Now, it's very tempting if we see somebody, a friend, a family member who looks very good, maybe they got a haircut, a nice outfit, to compliment them on that. There's nothing wrong with that. I'm not going to say that you can't ever do that, but challenge yourself to compliment people on things that don't have anything to do with their physical appearance. Maybe some facets of their identity that they don't get to hear about as much, or maybe they did something pretty spectacular, pretty great recently, and they would love to hear more about their talents or their achievements. It's a great way to get people to look at themselves outside of their body, outside of just their physical appearance. There's also a lot of benefit in engaging in certain types of movement. So when people have an inaccurate perception of their body, or when they do have a negative attitude towards their own body, it can lead to people becoming very alienated from their own body. At the most extreme, we've actually seen people look at themselves in the mirror and not recognize that the person in front of them is them. It is possible to reach a very, very high level of body alienation, body disconnect. Movement is actually one of the greatest ways to get back in touch with your body. You can do this by engaging in body scans, where you basically direct your attention to how your body is feeling, basically from the very top of your body all the way down to your feet, and really notice any sensations or any messages that your body might be trying to tell you. Engaging in mindful movement-based activities like yoga or walking and how your body feels doing these activities. And seeking out dance movement therapy. It's a fantastic sort of therapy that really helps people connect with their bodies. We've seen it used the most in the context of eating disorders, but it can actually be something very beneficial for everybody. And then finally, this is my favorite activity of all of them, gratitude journaling for your body. So a lot of you may be familiar with the practice of gratitude and gratitude cultivation. We're taking that same context and applying it to our body, to our sense of body image. We direct people to focus not on the appearance of their body, but on the functionality of their body. And even if people do have limited functionality, there's still benefits that people can derive from this activity, because we're aiming for them to look at what their body is still able to do for them. So the way I always opened up this exercise is by saying, if you have ever seen a beautiful sunset that really touched you, if you've ever eaten a delicious meal, gone to a comedy club and had a great time, or maybe had children and really loved the experience of being a parent, what made all of that possible? It was your body. So as a way for us to close, one thing that I'd like for us to take just a moment in is to stop and think about something that your body has done for you, even if it has absolutely nothing to do with the physical appearance of your body. Just take a moment and think of something that you're grateful that your body allowed you to do.
Muchas cosas. Me he llevado muchos viajes, me he caminado cantidades que ni las he sentido cuando estoy.
Dr. Huizar, I'm so sorry. Go ahead.
No problem. I just think someone had their mic on. So let's just take a moment to think about that. In my particular case, I am very grateful to my body for allowing me to dance, for allowing me to hug my friends, for having allowed me to learn and get my doctoral degree, which is something I'm very proud of. And I'm very grateful for being able to see a lot of beautiful sights that I've come to see while I'm living in California. So that's what came to mind for me right now. And I hope all of you were able to identify a few things that your body has allowed you to do and sit with that sensation of gratitude for a moment and really savor that. So I'd really like to close by just saying that body image improvement is a journey. It's something that takes time and that takes effort and patience to cultivate. But if you do make it a constant part of your wellness journey, it's something that you will reap a lot of benefits from. And I really encourage all of you to give it a try and see what sort of improvement it can have on your life. That concludes my talk, and it's been fantastic to be able to talk to all of you. I am going to just share here some resources that the pain department has available. And I encourage all of you to take a picture of it or a screenshot if you feel it's something that you might get some benefit from. I'll leave it up there for a moment.